I know that many people are feeling fear and anxiety about the spread of the coronavirus. That's entirely understandable. This is an unprecedented situation, both in the nature of public health challenge and the steps that we are taking to protect our residents. So tonight, I want to talk to you about what the city has done to be prepared, how we'll continue to work together to keep the people of Boston healthy and safe, and what this crisis demands of each and every one of us, individually, together, as we move forward. Make no mistake, this is a serious situation, but we are blessed in Boston with some of the world's brightest minds in medicine. Teams at City Hall and across our communities are working around the clock to plan and support every phase of life in our city. And I want you to know we are not powerless and you are not alone. Here are the facts. To date, 218 residents of Massachusetts have tested positive for the coronavirus. 42 of those cases are here in the city of Boston. Public health officials expect those numbers to increase in the near future. But with knowledge and collective action, we can slow that growth. The most common symptoms of the coronavirus are fever, coughing, and shortness of breath. Most people recover by managing their symptoms at home. If you think you're getting sick, isolate yourself from others and call your healthcare provider or call 311 to talk to the mayor's health line. But, and this is important, older adults and people of age are certain health conditions are at greater risk for severe complications, including pneumonia and bronchitis. Any one of us could put them at risk. That's why we're working so hard to slow the spread of this virus. And that's why we're asking every single resident to help, no matter your age or your health status. The actions of all of us take now will save lives. So keep thoroughly washing your hands and sanitizing your hands frequently throughout the day. Keep wiping down surfaces with disinfectant. Keep covering your cough and sneeze. And above all, avoid crowds, maintain a distance of at least 6 feet from other people, and stay home as much as possible. It's okay to go out for a walk and get fresh air to clear your mind. But remember, this is not a time for house parties, play dates, or visiting friends. We need everyone to limit their contact with each other right now. This is the social distancing that we're learning and practicing together as a city. It's a new situation for our city, but it's a known solution to the challenge we face. And I want to be very clear about how it works. Social distancing is not only for people in high-risk categories. This is everyone's responsibility because anyone can catch and spread this virus. It's especially important for younger, healthier people to think beyond your own personal concerns. Think instead of the power and the responsibility that each of us has to protect the people, especially the most vulnerable, we share with our city. You may have heard about flattening the curve. That's what this is all about. We will see numbers increase in the coming days, but we can prevent the kind of spike that could cause our health system to be overwhelmed. With social distancing, we can slow the spread and give our world-class medical providers the time and resources they need to treat everyone who needs care. We simply need everyone's help. And that's how we'll get through this. And that's how we'll get back to life, into a normal life in our city. And that's what we're doing right now. In the city of Boston, we've taken early and decisive action. The Boston Public Health Commission has been on this situation since early January, monitoring all cases, informing our response, and maintaining constant contact with our partners in government and in healthcare. To give us the ability to respond quickly with resources and coordination, we have declared a public health emergency in the city of Boston, joining similar declarations by the federal and state governments. To keep you informed and supported, we've created a webpage, boston.gov/coronavirus.